Breaking the wall to cooperative medicine. How open systems and new incentives will redefine healthcare. Stephen Friend, Sage Bionetworks, Seattle.
On the 9th of November 1989, I was working within the Harvard Medical School.
Before I talk about walls and breaking walls down, it's important to first start talking about illusions, opportunities, and denial. We see in the public press examples almost every week of discoveries that are remarkable. We see examples where titles say that scientists are going to find a treatment for every type of cancer, and sitting behind that is a powerful insight, CD74. We see examples where, for example, this week, the press wanting to make heroes out of scientists, as if the knowledge is around the corner, will put out titles such as Alzheimer's breakthrough hailed as a turning point. We even see DNA used as if it's some sort of fashion statement, as if we have it solved, because we want scientists to come through with these discoveries. The reality is that it's actually not that easy, and we're not that close. And you can look at it in many ways. You can look at the fact that the GDP in Germany, somewhere around 11% of it is spent on health, and I think longevity is something like 14th. In the United States, 17% of the GDP is spent on healthcare, and I think it's like 28th in terms of longevity. And so I think we have to ask ourselves, where is this illusion? Where's this discontinuity? If we're that close, why are things not working out more easily? And it's pretty simple. I want to give a sense of the complexity that is actually there that we need to understand in order to get those insights, in order to get that impact from, so that it can occur. We, in our books, in our lay press, and sort of the way we think, like to think of cells and all of biology in fairly simple terms. You know, there's a nucleus, there's a cytoplasm, ways of explaining things, and that's because our brains are wired for the narrative. We love storytelling. We like to go, this turns into that. And the difficulty is that actually is not the way biology works. Biology is incredibly multi-dimensional. It has many facets. You tweak one thing one place, you get an effect in another. What we know now, that we can begin to have probes and hang microphones around the cell, is that actually for any little diagram you draw for one cell, this connects to this connects to that, they all connect to each other. And as you begin to do that, what you begin to realize is that system is wired to keep us going through evolution in a way that gives us our resilience, but it's really hard to unpack that hairball and try to figure out what's really going on. I am jealous of chemists, mathematicians, and physicists, because in chemistry and in physics, there are rules. In chemistry, there's a periodic table. When you take this and you put it with that, it does that. I put this diagram or this picture up here because we should acknowledge that in medicine, we are alchemists. We're about where the chemists were in the 1700s. We don't know the rules. And if you want science to come through, if you want it to have an impact, we have to figure out how we're going to find those rules, how we're going to understand something other than the broken component parts. And the reason I bring this up is that I think we are not properly positioned, and we don't reward our scientists, and we don't engage the citizens to accomplish the discovery of these rules. When students, like the 100 or so lab scientists that we have in the audience, are going through their career, they're playing their career, their impact, as if they're in some sort of Warhammer game. They're looking, can I get to this university that has this resource where I can find this? I can get a first name, last name author on a publication in order to be able to get moved through my careers. And in terms of who can and cannot make insights, we're pretty medieval. We're still working as if there were guilds of people who are called pathologists or called protein physiologists, as if only certain members of our society were capable of doing that. And at the same time, citizens, particularly those with illness, are often treated as voyeurs. So the question that I want to bring up is, can we actually build a different system? Can we build a system in which everyone is being engaged? It's been calculated that there are 1 trillion hours a year of participatory value that's up for grabs. That means instead of watching a football game or doing this or doing that, people could engage that much activity in terms of trying to understand things such as our health. And medicine is moving from a symptom-based approach to medicine to understanding mechanisms to now actually trying to understand computational modeling. So what I'm saying is I think there is a fundamental state of discontinuity between our institutions who are expecting the answers to come and actually the power, the energy, the surplus that is out there in order to solve those problems. And what we need to be thinking is how can we build a set of individuals, in fact, millions of individuals, who can carry out biomedical research. So for the last 4 years at Sage Bionetworks, a nonprofit in Seattle, we've been testing little projects, little pilots, asking how could you actually get people to work in more open, collaborative ways? How could you get a scientist, when they have a eureka moment, to actually share it with everyone they possibly could? How could they get credit? How could you get around these guilds of experts? Because if you think of the time that goes on between when you want to communicate something, the 400-year process of having things in journal articles is one that's a little sluggish. It takes a little bit of time to go between when you have an idea and when you get credit for it. Imagine that that could happen instantly. And the physicists and mathematicians, again, use a system named Archive, and the software engineers have been using systems such as GitHub, where millions of software engineers work together, looking at changes, actually people getting credit for what they did, not what they said that they did. So we've built a system called Synapse, so Geek's Sandbox to a certain extent, which allows individuals to talk to each other, to share their ideas, but most importantly, in reference to Baroness O'Neill example of accountability, transparency, allow the person to get exact credit for what they did, where it is, who did what, how did you solve that problem. And to give you an example of that, this past month was 9 months from when a set of hundreds of investigators in dozens of institutions were given a set of data, and all the individuals actually did this on Synapse. This TCGA project in cancer allowed those individuals to actually go and submit 20 papers in a period of 9 months, because they could see who was doing what, how that data was shared. Now ICGC, another cancer group, and TCGA are working together on that. But where it's begun to get even more interesting is we said, why should we just have guilds of experts looking at data? How long would it take if actually we allowed anyone in the world to look at that data? How could we structure challenges so that the people who generated the data were not those that analyzed, that we let the world analyze that data? So the last year's experiment was to take 2,000 clinical and genomic records from the UK and Canada, put them up in Google, and allow anyone in the world, which ended up being 30-some countries, to come in and see if they could do better than the classifications that were out there commercially available. It took 6 weeks for those individuals to be able to beat Stanford, to beat the Broad, to beat the classical places where work was being done. And they did it because they had leaderboards, they could see who did what, they could work together. An electrical engineer at Columbia who knew no biology actually ended up being the winner. And what did they do it for? They wanted to have a publication, and the winner was able to have a publication where they needed it in order to get recognition. At the White House in June, we announced a project that's brought together, and actually it was also announced in New York 2 days ago, in Alzheimer's, where we're taking databases in the UK, in Canada, in the United States, and we're fusing large data sets, making them interoperable, and saying, can anyone in the world solve those puzzles to see if they can have insights? But the challenge, I think, is even more interesting is one in arthritis, where we ask the patients and their own recognition of pain that they had as a way to put that up in the cloud for marketed drugs. Why can't you take marketed drugs and ask, who should really be getting drugs like Enbrel, the anti-TNF drugs? Why can't citizens be putting their data in on what had not happened to them? And so we have Arthritis Responder Challenge that's going on, funded by actually number of individuals and institutions. But let's now stretch it one more, which is saying, let's look at how do we engage citizens even more. How do we democratize biomedical research so the phenotypic data that is so very valuable was actually coming in directly from patients and then allowing many people to look at that? Why can't the public be seen as actually being part of researchers, not just as patients? And so in the projects that have been funded by the Robert Wood Johnson Foundation, I'll just give you one example. Took the iPhone, and Max Little at the MIT Media Lab figured out a way where the microphone here could do a 99% specificity, 99% accuracy recognition of how severe Parkinson was, instead of going to a doctor many miles an hour of practice. And with patients like me, we're beginning to look at how could that be actually distributed across the UK and across Sweden, so patients like Sarah Regari could record 3 times, 4 times a day what was going on objectively with their disease, subjectively narrative, and then host that up in a cloud so we could take anecdotes and turn anecdotes into signal about why that disease gets better or gets worse. So now to the point that I really want you to think the most about. I was talking to a friend from India, and I asked him about corruption. I said, what's the corruption like in India? And he said, the corruption of graft is not what worries me. What worries me is the corruption of denial. It's what we don't let ourselves think about. Socrates, his bust is in the Neue Museum here in Berlin, was sentenced for corrupting the youth. I want you to think about those things we recognize as things that we should not have, such as the Berlin Wall. And think of efforts that we go, why is it unable in Iran to have cell coverage going on? And we can recognize that there needs to be openness in data there. Ai Weiwei was on the phone earlier, and we can recognize when China says it's going to mute the Dalai Lama, this is wrong. So we are programmed to go, this is wrong, this is wrong, this is wrong. We should recognize that if patients could see inside the walls of institutions, that they would want researchers, when their data is curated properly, to be sharing not just their data, but their ideas immediately. We have gone into a system of silos where people are expected to work towards valorization, towards their institutions, in a way that sometimes is not the best in terms of helping patients. And in fact, in the United States, the NIH is actually, by law, not allowed to demand that scientists share their data, but the NSA listens to all of our records. So here is the call of action in 26 seconds. If we're going to be able to have GPS for health that actually allows us to know when we're in illness or in sickness or in wellness, we're going to have to think beyond the current medical industrial complex. And the challenge I want to leave you with is there are very simple things we could do. We could make it so that whenever a patient goes into a clinical trial, there was an option that said, I might want to share my data. So my challenge to each of you is think of those walls that are keeping us from working together, that could allow us to share data, to get insights in real time in order to break down those walls that are there now. Thanks very much.